into its new state, a beautiful butterfly which can then emerge. Sometimes we retreat from the world to heal and transform ourselves, and then we need help to emerge. So that's why we use that, because when you get a diagnosis of mental illness, sometimes you do retreat, but you can emerge into the world as a beautiful butterfly. Fragile, but still strong.
Okay, living in the cocoon. Before the cocoon actually breaks, we talk about how the cocoon develops, and it can either be self-imposed or imposed by the diagnosis of a mental illness. It can be imposed by stigma around mental illness that can prevent people from accepting the illness and opening up to share their symptoms and seek help. Religion, culture. Culture in some cultures, mental illness may be viewed as a weakness. Some people view their culture as a weakness, and that puts them into the cocoon. Otherwise, religion and spiritual beliefs and practices, in many ways, or for some people, it's a healing process of recovery, and it's used as traditional religious practice to treat mental illness. They may view the illness as a spiritual issue. A person may experience an internal struggle or conflict about their beliefs in many ways, and what to do in accepting treatment and medication. And this may have a negative impact on health and well-being and create conflict with others, or may have concern about opposition from religion figures around using mental health services. Family. Family may want to keep the illness a secret, and therefore the person is told not to tell that they have a mental illness, and therefore can't break the cocoon. Another way is fear. Fear of what may happen if they open up and tell others and share their mental illness. People may retreat into a cocoon for safety and silence. Living in a cocoon creates isolation and exclusion. It creates barriers to correct diagnosis, barriers to care and support, barriers to communication and seeking help, and barriers to inclusion, social, community and religious inclusion, and barriers to just have basic opportunities in the community. These barriers may make well-being unattainable.
So are there any risks in staying in the cocoon? Well, there's a list of risks up there. Whilst a cocoon can offer a place of safety to heal, recover and accept an illness, there are risks. Staying in the cocoon may compound the isolation already being experienced and further distance a person with mental illness and their family from help. It can create possibilities of retreating further into self by self-medication. Drug and alcohol misuse, self-medicating with alcohol or non-prescription drugs, or abusing prescription drugs further isolates and exacerbates the illness and makes getting help harder, retreating further into the cocoon.
I had to say
Evan was just talking about transcultural mental health services. We don't have enough of them. We don't have one in Canberra, where I come from. We certainly have them in some of the states and territories, but they are really vital to the health of people from multicultural backgrounds for a range of reasons, which you see up there. But just expanding on some of those, they offer specialised support and work in partnership with cultural communities, forming a therapeutic alliance through flexibility and culturally appropriate models of care. They actually use the inbuilt resilience in cultural communities to help people from CAL backgrounds to identify the resources within their own communities that can assist with recovery of a family member or friend from mental illness. And they also have good working knowledge and understanding of the value of cultural and religious and spiritual practices. And a religious belief can be a protective factor against suicide in some cultural groups. So transcultural mental health workers can help people with an illness and their families by negotiating between spiritual and religious leaders and mental health care providers to ensure that care plans also incorporate spiritual and religious needs. Some cultural communities we've heard earlier about the requiring specific needs around gender that they are adhered to when seeing a GP or specialist or receiving any treatment and advice. And so these services are able to provide that care which is respectful and understanding. And they can also give people of multicultural background who are carers and consumers good guidance and referral to other services and supports based upon their knowledge of what works with each cultural group. And this empowers culturally, linguistically diverse consumers and carers and their families to make choices. And that's very valuable and to help them towards recovery. They also have access to TIS, or Translator Information Interpreter Services, and providing interpreters who have the right kind of training in mental health literacy and who can attend appointments either with the person or via the telephone. And they also have other resources that they can provide access to relevant information in the person's own language. And too often we see translated information which is faulty or flawed, so it's important that that information is relevant. They employ staff who are from diverse cultural backgrounds, as somebody said earlier about the increase of numbers of people with multicultural backgrounds working within the service. And that's so valuable because it can transcend many borders and become a great culturally learning environment. And people who are born overseas often have similar or common experiences of migration and settling in a new country. And these shared stories can actually create a starting point for a conversation with a client, patient or consumer and their family. And I think also these sorts of services are really valuable because they actually can provide access to a consumer or carer, peer worker who's of different cultural background, who can help with advice and understanding from their own experience of mental illness. So by providing specialist transcultural mental health services, culturally appropriate models of care and working with communities, families and clinicians and clients of CAL background and their families can actually overcome the barriers and start to emerge from the cocoon created by mental illness and stigma. And we're nearly done.
Certainly there are barriers between clinicians, services and our consumer and carers. What we need to do is to reduce those barriers, and how we do that is by creating a user-friendly service. 1. 2, by creating culturally and supportive recovery environments. 3, by creating pictorial information posters, because pictures, every ethnic group can read a picture. So pictures of posters to define what the message is the best way, or information posters in other languages other than English. By providing access to interpreters when needed, by understanding people's culture and empowering choice, by providing CALD peer support workers, peer support consumers, peer support carers. That's an important one. I know it takes a duration of time to get this going, but once it's happening, and once peer workers get into a working group and actually something positive comes out of that, it's the consumers and carers who are the customers of the service. So if you want to know how the service is run, you ask the customers. By ensuring best practice through training staff, obviously, by developing and implementing operating practices, standard operating practices that are culturally, linguistically diverse, appropriate, policies and frameworks, inclusion of CAL consumer carers in quality improvement and feedback mechanisms. You've got to get the consumers and carers feeding how the service was delivered to them, and then get that information, use that information to reform the service accordingly to improve service delivery towards best practice. And by creating, well, we mentioned that feedback mechanisms by collection of stories and experiences of service use, as I mentioned before, from people that don't speak English, by using interpreters or by English-speaking people that are of immigrant backgrounds.
So, emerging from the cocoon, what are some of the benefits? Well, I think probably we all know what they are. I'm just wondering if there's anything really important here. It just creates more opportunities for people and their families to gain help through a range of supports that are available, including counselling, cultural support groups, respite care, arts-based activities and other programs. And also referral to training and education opportunities in the community that are specifically tailored for those living with a mental illness. My son got involved with the FAMS project and it's just absolutely changed his life. It's just amazing what's happened to him, and he wants to do more things. It's been a blessing. I actually am so exhausted because I think all the tiredness is catching up to me from caring for him, but it's just taken a load off me. So also, with adequate support, a person can return to work or take up studies at university or college, or participate in other formal or informal training opportunities such as community radio or advocacy and peer workforce training. And carers too can get into training such as mindfulness or yoga that helps alleviate stress from the caring role, or train as advocates and carer reps, or have access to study to return to respite support to return to study or work. So I suppose having a meaningful life through becoming more active in their community, social, religious, sporting and work, and to help others with mental illness, like that's what we hope we're doing, Evan and I. And of course, less anxiety about who knows about the illness. Through education and gaining awareness, people, their families and communities can accept that illness is not something to be feared. And family also can become a very valuable resource for consumers and carers. And extended family and friends can also give that extra support and be there to help when they're needed. So those are some of the wonderful benefits.
So there's obviously life beyond the cocoon, and that's the chrysalis, which is the cocoon itself, and then to a wonderful butterfly, a colourful butterfly. Well, now you have emerged from the cocoon when one has found a new identity beyond the diagnosis, realising that mental illness and the symptoms are just a small part of one's life. There's a lot more to one's life than the actual mental illness. There's other strengths, qualities, abilities that the person has beyond just the mental illness. Recognising the strength and the strengths, abilities, and families have, and which can open to one's life and community to many possibilities. When you and your family are able to be involved in meaningful work, creating connections, building support networks, creating a happy medium, and living life and thriving with life, is when you know you've become a butterfly. And what Anya and I wish to impart today through this presentation is that there are many cocoons that have that possibility of becoming butterflies. And we hope that many cocoons, there'll be more butterflies than cocoons. More butterflies, colourful butterflies, effectively and meaningful in the community, doing constructive work. In fact, I can tell you now, in where I work a lot among carers and consumers. There are a lot of consumers in my local area that have become champions in the community. They have done things in the community that people with not a mental illness find hard doing.
So thanks a lot for listening. It was a lot of